Are you considering laser treatments for age spots, acne scars, or hyperpigmentation? Today we're going to be talking about the difference between IPL versus lasers. Hi, my name is Christy, and I've been treating clients with hyperpigmentation, acne, and other skin conditions for over 11 years. And so if you haven't caught our hyperpigmentation series yet, that's what we've been doing. We have been focusing on hyperpigmentation. So let's get started. So first, do want to tell you that this video is for educational purposes and somewhat entertaining purposes. It is not to treat or diagnose or even tell you that you should be doing laser. You still need to go in and have a consultation with a laser technician professional. We also wanted to tell you that every client has different skin based on the age of the client, their medical history, contraindications such as medications that they're using topically and taking orally, as well as skincare products that they have been using and other skin treatments that they've previously done. So it's going to be very, very unique and specific to that individual. So if you are considering laser treatment for hyperpigmentation, please make sure that you watch this video to get some very general knowledge so that you can go in and ask more educated questions to make sure that the laser treatment, if you decide to do so, is the right one for you. And moving forward, all the links to the studies and the sources for products will be linked in the description below. So although lasers and light therapy can treat everything from rosacea to vascular skin conditions, we are focusing today on age spots, acne scars, hyperpigmentation, including one that is a brand new laser technology, so stay tuned for that one, as well as we're going to be talking about a pro tip later on in the video as well. So IPL, otherwise known as intense pulse light, is used for specific or various skin conditions, same as lasers. However, IPL works in multiple wavelengths, both in the visible light and infrared spectrum, where lasers are more direct in one specific wavelength. IPL is also known as photorejuvenation because of the multiple wavelengths that target chromophores in a single setting. And chromophores are basically part of the molecule that's responsible for its color. So IPL's unlike laser, it's basically less direct than a laser. So think of a laser pointer versus a small to medium flashlight where the light is not as direct. It's in the general direction, but it's a little bit more diffuse. However, IPL is still used for hyperpigmentation, and that's why we're mentioning it today. It also helps lessen and decrease blood vessels. So it can also help with hair reduction, acne or age spots, telangiectasia, rosacea, sunspots, and Poikiloderma, which, if you don't know what that is a type of hyperpigmentation that usually happens around the neck, and that is mentioned in so if you have hyperpigmentation around your neck or your chest, please go to the anti-aging tips for neck and chest. And IPL is actually better suited for Fitzpatrick's 1 through 3. It actually works better on epidermal melasma versus mixed or dermal melasma. Now, IPL can also be administered on the face, the décolleté, the hands, the arms, and the back. So here are some downsides to using IPL. So there can be some crusting that occurs 1 to 2 weeks after the treatment. And there's been some clinical studies, and again, those links will be in my blog, which the link to the blog will be in the description. And then in the blog, you will see the studies all the way down below. So basically, based on these clinical studies, it shows that IPL tends to work better when paired with a hydroquinone treatment or a pretty aggressive topical treatment. There is more chance of, because I think it's maybe because the energy is diffused, that there's more chance of a reoccurrence happening. And so then if that happens, you do have to continue post-topical treatment, a pretty aggressive post-topical treatment, 6 to 12 months after the treatment to prevent or reduce the chances of reoccurrence. Now, before we move on to lasers, if you are finding this information helpful and you're liking just some of the information, or you watched our hyperpigmentation series and you still haven't subscribed, then please make sure you hit that subscribe button, hit that notification bell, and don't forget to give us a thumbs up letting us know that you like these types of series. So moving on to the next one, which is lasers. Laser stands for light amplification by, let's try it again. Light stands for laser.
Light stands for
laser. Gosh, I'm getting hungry because you can tell. Light. Laser stands for light amplification by stimulated emission of radiation. So as mentioned previously, laser light is more direct and specific in direction. Laser lights are composed with one specific light or wavelength, composed with a medium such as liquid, gas, metal, or solid. The light produced is directed at specific chromophores or specific targets, such as pigments for hyperpigmentation or ink for tattoos, oxyhemoglobin for vascular lesions such as rosacea or poikiloderma, or water for resurfacing. When the light hits the target, it triggers a reaction. This is why sometimes you hear that lasers have best results when there's a contrast. So for example, dark hair on fair skin. So there are quite a few types of laser. I'm going to skip over the ones that are used more for vascular and some hyperpigmentation to focusing on just the hyperpigmentation. So there's one that's called a ruby laser. So the ruby laser was originally used for hair reduction, and now there's more advanced techniques that are being used for hair reduction, and now it's used more for tattoo removal and hyperpigmentation by using high energy pulses. Now the ND YAG laser, also known as the neodymium yttrium aluminum garnet laser. This is a type of crystal that is used as a medium for solid state lasers. So this is a more advanced type of laser, and it can actually target both blood and pigment. And some of the benefits of this laser is that it penetrates deeper into the dermal layer, so it can stimulate collagen production, and it's actually has been shown to have better results with higher Fitzpatrick types, which most lasers for most higher Fitzpatrick types tend to not have or have mixed results. So this may be actually better for darker skin types because of the longer wavelengths. So this can be used for laser hair removal. It goes deeper into the deeper veins, so it can be used for varicose veins, and decreases the chance of post-inflammatory hyperpigmentation for Fitzpatrick 4 through 6 skin types. And this other newer laser technique, which is fairly new to the scene, is called a Pico 4 laser. And unlike most lasers that are not usually recommended for darker skin types, this actually is approved for all skin tones, and it's FDA approved, and it can work on hyperpigmentation as well as hair removal, especially tattoo removal. This actually shatters the pigment or the ink in tattoo removal, so there is faster results, shorter treatment times than conventional laser treatments. So even though this may be a little bit more expensive because of the shorter downtime or little to no downtime, it can be used for darker skin types. This may be one you may want to look into. So if you are considering laser treatment as a part of your hyperpigmentation treatment, here are just some of the lasers. There's so many more. I could have gone on and on, but to kind of make the video shorter, these are just some of the main ones that you have at least a working knowledge before you have your consultation, because we do want to share with you that one of our clients who happens to have darker skin went and got laser treatment for under her arms for laser hair removal, and we're going to put some of the pictures up. She actually was kind enough to let us use them to show some of the results that happen, and I did tell her to avoid any heat type lasers, and so this is kind of what happened. So if you are getting treatment for this, the most important thing is to reduce inflammation, because if you reduce inflammation, it is less likely that you will get post-inflammatory hyperpigmentation. So I put a link in below. One of the ones is the post-treatment cream. We've had wonderful results where clients have gone, obviously somewhere else for laser treatment and have gotten this. People who have sent away for this. It reduces inflammation. It has occlusive agents and humectants in there, and the pH is actually stable, and it's perfect enough for healing the skin. So the links will be in the description below. And if any of you have had laser treatments, we want to know what type of Fitzpatrick skin type that you have, what the results were, and how you had them, both good and bad. So make sure you put those in the comments below. And remember that makeup is an art and skincare is a science.